Thank you for having me.
Thank you.
Very generous of you to say that Matt Hancock's giving evidence at the inquiry, Julia.
Well, we'll come to that. And I must say, Russell Quirk is still with me in the studio. I know he'll want to put his tuppence worth in as well. Let's just play a couple of little clips of what Matt Hancock has to say, and we'll talk a little about what other people have said about him. But I do want to get to rather more nitty-gritty stuff that does actually matter, because it is extraordinary, the criticism that Matt Hancock has come under from, I mean, God, and neither of us hold a candle for him, but if you go through all the different criticisms he's had, Dominic Cummings called him a proven liar. Helen McNamara is a former senior cabinet secretary. She said he'd say things in meetings that we discover weren't in fact the case. Sir Patrick Vallance said he had a habit of saying things without evidence to back them up. Simon Case, the cabinet secretary, said he was part of the government's weak team. Simon Stevens, the former NHS chief, said he wanted to decide who should live and who should die. He's accused of over-promising. I mean, they've really been very critical. It's quite clear that everyone, scientists, ministers, the advisors, have all decided that Matt Hancock is going to be the scapegoat in all of this. This is what Matt Hancock has had to say about his attempts to, as he say, wake up Whitehall earlier on in the pandemic.
From the middle of January, we were trying to effectively raise the alarm. We were trying to wake up Whitehall to the scale of the problem. And this wasn't a problem that couldn't be addressed only from the health department.
He also was saying that the government's COVID plans weren't adequate. Here's what he said about that.
I take issue with absence of a plan. There wasn't an absence of a plan, there were plans. I've critiqued the plans. I've said that they weren't adequate, but there were plans in place.
Well, I mean, yeah, there were plans in place. They were the pre-pandemic planning, which didn't involve, by the way, Laura Dodsworth, locking us down. What do you make of what Matt Hancock has said today, and indeed the questions asked of him and other witnesses giving evidence to the COVID inquiry over recent weeks?
Oh, my goodness, how long have you got?
Where do we start? Yeah.
Well, first of all, I think scapegoating of Matt Hancock is entirely predictable. He was always going to be the weak link that would be blamed for everything at the end. But I don't really want to get caught up in the weeds of all of the abuse that they're hurling at each other, because it's still to ignore the main questions that the inquiry isn't asking. So he's saying he wanted earlier action. I know you'll agree with me, Julia, that the main question that the inquiry is failing to ask is, did lockdowns work? One report published by the IEA found that potentially only 1,700 lives were saved in England and Wales by locking down. Now, the NHS normally applies something called a quality adjusted life year, and the upper limit for that would be £30,000. Let's think about what was spent on lockdown and how much that would equate to for 1,700 lives. It is insane. At the moment, I think that we're still seeing a lot of the illusion of control. People who enacted the policies want to believe that they worked. This inquiry has got a pre-baked outcome that lockdowns worked, and it's just a question of when the levers were applied. If we don't answer this question, the lockdown's entirely failed. It's not the only question that the lockdown's failing to ask. Why did we rely on modelling, which was so flawed?
And we relied on modelling, not just, but Laura, not just at the beginning. You think, OK, you're relying on modelling. I mean, you could give some sort of excuse for that before, you know, as the pandemic just starts. But they were still using modelling, 6 months in, a year in, 2 years in, when you already had real-world evidence. And that's what happened December 21, when we had the Omicron variant, when they were still saying, oh, everyone's going to die if like they are in South Africa, even though, of course, people weren't dying en masse in South Africa due to this new variant, if we didn't lock down in December 2021. And we didn't lock down. People carried on life fairly sensibly as normal. And what a surprise. Those models turned out not to be true.
I think you're being a little bit too generous. I'm going to give you 3 reasons why we shouldn't have relied on modelling to lockdown from the beginning. First is the World Health Organization report in 2019 recommends against using modelling because it is flimsy and not evidence-based. We relied upon modelling, which came from work led by Professor Neil Ferguson from Imperial. Now, let's not forget that his previous modelling predicted that up to 200 million people would die from bird flu worldwide, when less than 500 people died. Also, the modelling didn't take into account the spread of COVID in hospitals, care homes and prisons. Now, considering that something like 40% of those deaths in the early days came from care home residents, and something like 2/3 of serious illness was spread through infection hospitals. That was huge. That was a huge omission. So we shouldn't have relied on modelling from the outset. Professor Robert Dingwall has been very clear on this. The government lent too heavily on modelling and not enough on generalists from people with experience in this kind of kind of work.
The people who would have been involved in pandemic planning. And this is the thing, we're constantly told, I mean, the narrative is, well, of course you would lock down. Obviously, that's what one would do. You're crazy. I mean, you and I, people like us campaigning against this, you rather earlier than me, I have to say, in 2020. We're just granny killers, that's all we are. But that Sweden did this extraordinary experiment of not locking down. When that's literally turning facts on its head. This is not an opinion. This is a matter of fact. No country's pre-pandemic planning in the Western world, and I think even in China's, had ever envisaged a lockdown. Lockdown was never discussed by stage. We know what they discussed. It's in the minutes. They never discussed it. Why? Because, of course, you didn't lock down, because, of course, it wouldn't save lives, because, as we were told by the Valence and Whitty at those press conferences, you cannot stop a virus. That's just not how viruses work. So what Sweden did was follow pre-pandemic planning. And we are, the rest of the world are the ones who conducted an experiment. And we know from the outcomes, long-term excess deaths, of the cost and benefit analysis of all causes, it is quite clear that Sweden did the right thing and we did the wrong thing. And yet, it appears that no scientists involved in this planning, no politicians, no aides, none of the civil servants, none of the media who called for these lockdowns, none of them are even open to even asking that question. They still think that you and I are conspiracy theorists. Why?
Well, I mean, absolutely. The World Health Organization was very clear that any sort of non-pharmaceutical intervention, including lockdown, doesn't stop infections. It spreads them out over a longer period of time. That was well understood. I think that it was Chris Whitty and Patrick Vallance also referred to this in the very early days. You can't stop a virus. Governments cannot turn viruses on and off like a tap. You can just spread out the infections over a longer period of time. As you say, Sweden is the case study. But you mentioned cost-benefit analysis. Now, if a government does decide to apply a lockdown, it's its duty to conduct a cost-benefit analysis. There was no cost-benefit analysis, not until November 2020, and it didn't actually quantify any of the effects of the lockdown. So it was something like something that a sixth form student would produce. It was an embarrassing piece of work from a government. I'm happy to say that it really was terrible cost-benefit analysis. It's only now in the aftermath that we're really getting to grips with it. It's been a huge global policy failure, and it's just devastating that this lockdown won't address it. So far this morning, Matt Hancock's been asked the wrong questions and giving the wrong answers. For instance, why was there not more wide-scale testing? Let's question another piece of the dogma. There was never any evidence for large-scale testing. When they tested people, the PCR test it's not designed to find out if you're ill from COVID. It cannot distinguish between somebody who is pre-symptomatic, convalescent, contagious, or an erroneous false positive. It was a terrible idea to throw £37 billion down the drain. Are they interrogating that? No. They're asking why they didn't do more of it and earlier.
And also bearing in mind, we I think was one other country that tested on the same sort of scale other than China, and we've got no better results having done more of it. There's also, earlier in the week, Jenny Harries, who is now by the way, it's not like she's nobody now. She was our Deputy Chief Medical Officer in England. She's now the head of the UK Health Security Agency, so will play a role in future pandemic planning and future pandemic policy. She made it very clear in her evidence. She told the COVID inquiry that government advice on wearing masks was ineffective. Like this whole using two pieces of cloth and not that stuff. But her own reports at the same time, when they were making these decisions, was quite clear. There was no evidence that masks would make any difference. They put them on, not only us adults, on public transport, in supermarkets, many people having to wear them for sort of 10 hours a day at work. I hated every second. And then I declared that it would be a mental health problem for myself to have to wear one because I was too sane to wear one because the evidence wasn't there. But they put our kids in them, which I think is still unforgivable. They knew there was no evidence. We know from the stuff that's come out out so far, that basically they put the kids in them for 8 hours a day because Nicola Sturgeon had done it in Scotland. They didn't want the political row. They knew there was no evidence. They did it anyway. People are still wearing them now who still think they're saving their loved ones' lives or their own lives by wearing them. This is a complete con and a complete lie. I am still stunned by how angry people are not about being absolutely blatantly lied to, forced to cover their faces for no reason whatsoever. Not only did it not save a single life, it has damaged our children irrevocably. I think it's damaged our society irrevocably as well. Why are people not more angry about this? Or why are people not, frankly, demanding a full-scale apology for this?
I am so glad to hear you use the word lie, because we need to be very clear about this. The UK government, the public health authorities, police, schools, everybody lied about the effectiveness of masks. We're in this astonishing gaslighting phase of the inquiry. I'm smiling because otherwise I'd be bashing my head against the desk right now rather than speaking to you. Yes, Dame Jenny Harries has admitted that there was never good evidence for face masks. I mean, there was this embarrassing advice on the government website about how to make your own mask out of cloth. What absolute tosh and nonsense. The Cochrane review, even now, and it's the gold standard in evidence-based medicine, is very clear that there was no good evidence for masks. There was one study that came out during the pandemic that analysed the bacteria, fungus and pathogenic microbes in cloth masks. And yet this was mandated in the summer of 2020 throughout England, Scotland, Wales at different times. Masks were mandated on transport and in shops. And you must understand the government knew it didn't work.
They knew. This is the thing.
Why did they do it?
It still blows my mind that people just sort of shrug and want to move on. I'm not moving on until people admit they did wrong, because as we know, they're going to do it to us again. Laura Dodsworth, I so appreciate you joining us. You've been absolutely magnificent. Your book, A State of Fear, How the UK Government Weaponised Fear During the COVID-19 Pandemic, is such an important book. And I know you've also written Free Your Mind, the must-read expert guide on how to identify techniques to influence you and how to resist them. They played with us during that time, and we need to be aware of it.